be performing vital signs taking. First, check physician's order for frequency and route of temperature measurement. Review medical record for baseline factors that may influence vital signs. Before anything else, wash your hands. After washing your hands, gather all the equipment. First is a waste receptacle, the tissue, thermometer, 2 containers with wet cotton, dry cotton, BP apparatus and a stethoscope, shutdown notebook and a black ball pen, and watch with the second hand. Hi Luna, I'm Lee, your nurse for today. How are you, ma'am? So today, I'm going to take your temperature. Get the thermometer and wipe it by cotton balls with alcohol from probe to stem. Ma'am, do you want me to pat your axilla dry? Press the on button to start the power. Then, place the thermometer probe in the center of the axilla. Place the client's forearm across his or her abdomen. Leave the thermometer in place. After hearing a sound, remove the thermometer and read the temperature. Ma'am, your temperature is 36.8 Celsius. Properly disinfect the thermometer. Wipe with wet and dry cotton balls, then return to container. Record her temperature. The next I will going to take, ma'am, is your pulse and respiration. Place lightly 2 or 3 middle fingertips over the radial pulse site. Using a watch with a second hand, count the number of pulsations for 1 full minute. While the fingers are still in place after counting the pulse rate, observe 1 respiratory cycle. Count respiration for 1 full minute. Pulse rate is 76 beats per minute and for your respiration is 22. Record the pulse rate and respiration. Her results are normal. Lastly, I'm going to take your blood pressure. Check if diaphragm or bell is open and functioning. Clean the earpieces and the diaphragm of the stethoscope with an alcohol swab or cotton ball with alcohol. Select appropriate arm for application of appropriate cuff size. Expose the brachial pulse site by removing any consecutive clothing. Place the bladder of fully deflated cuff over the artery by positioning lower edge cuff about 2.5 cm above the antecubital space. Check the needle on the aneroid gauge if it is within 0 mark. Palpate the brachial artery with the left index finger and middle finger pads. Place the stethoscope earpieces in ears and be sure sounds are clear and not muffled. Remove index and middle finger and place the diaphragm or bell of the stethoscope over the brachial pulse. Inflate the cuff 20 to 30 millimeters of mercury higher above the pressure pulse is no longer felt. Release the valve slowly at a rate or 2 to 3 millimeters of mercury per second or per heartbeat. Identify the manometer reading at which the first sound is heard. Deflate the cuff slowly at least another 10 millimeters of mercury, then rapidly and completely. Remove cuff. Remove and clean earpieces and bell head. Return to the case neatly. Record blood pressure reading. Ma'am, your blood pressure is 117/80 millimeters of mercury. Ma'am, are you comfortable with your position? So ma'am, I'm then checking your temperature, your pulse rate and respiration, and also your blood pressure. You may now take a rest, ma'am. So next, gather all the equipments. Dispose used cotton balls and other materials. Importantly, wash your hands. The results of your vital signs are within normal limits. If there are any abnormal findings, I will report it to the appropriate authority.